Good things, Delmarva.
Good morning, I'm Lenita Wesson, and you're watching Good Things Delmarva, a show where we take a look at all the great things happening in your area. My first guests are familiar with having to work towards regaining mobility and motion, particularly in the wrists and hands. Jen Hamilton is a hand therapist at Tidewater Physical Therapy, and Chris Eccleston is a patient who went through some intense therapy. They join me now to talk about the importance of hand therapy and how it can really help you get back to your life. Good morning and welcome.
Thank you.
So I'm glad to see you guys again. You'd visited with us on the morning show, and I want to start just with what is hand therapy? Is it, well, you work the hand, kind of like any arm of physical therapy?
Hand therapy really encompasses anything from the shoulder down to the fingertips.
Okay.
And we work with a variety of diagnosis. It could be something post-trauma, like what Chris had with his fractures. It could be something a little finger issue, some surgery, carpal tunnel, for example, or even if patients just have arthritis that they're trying to manage so that they can get through their daily activities.
So, Chris, we have talked before. You had, like I said, you went through some pretty intense therapy. First, if you don't mind, share as much or as little as you want about what happened, and then kind of let's talk a bit about what therapy was for you.
So, I had an injury a few years ago. I was helping a buddy of mine move furniture and was moving furniture off the back of the truck and fell off the kind of the ramp. And my hand was the one that took all the blunt of the injury. So I had a major surgery, was taken up to Union Memorial in Baltimore, had a 4.5-hour surgery to repair my hand. My entire wrist was shattered. And then after that, I had to find a certified hand therapist to kind of get me back to, being able to do everything. I'm left-handed.
Oh, wow.
So, I had to learn how to write again, just all the things that you don't ever think that you would need to know how to do, and Jen helped me do that. And that was probably a year-long process for me to go through.
The therapy, well, you went through therapy for a year.
Yeah, it was, just about 9 to 10 months, so
now,
almost a year.
When did you start therapy? Because you were saying when we were talking off camera, it's pretty important to start as soon as possible once you realize there's an injury or once you know. So when did you start therapy after your surgery?
I would say, 4 or 5 days after surgery, I was in there, and we were 3 or 4 times a week.
Really, that often?
For, like I said, almost a year. So, I mean, we spent a lot of time together, got to know each other really well.
Yes.
And I mean, I think it's a lot more than just hand therapy. I mean, it really played into my psyche, my self-esteem, and, Jen and her team kind of really helped me do that at Tidewater.
Jen, you had no idea you'd be a psychotherapist
No.
as well, huh? Now, how, just based on what we've heard Chris describe, was it expected that he'd get as much mobility back as he has? Because you're writing, you're driving. You said there are certain limitations, right, with working out and certain things you can't do, but he's in pretty good shape over there.
So with the type of injury and surgery that he had, he was not expected to get full range of motion back in his wrist. They typically say about 50%. He was able to get a little bit more than that. And a lot of times in therapy, especially hand therapy, what we focus on is getting the patient back to a functional status where they can do the things, even if they might have to compensate slightly for certain things. We want them to be able to get back to all the things that they consider functional for them and get back that quality of life.
Now, how important of a role did some of these play in terms of during the physical therapy and hand therapy and after as well?
So in Chris's case, he came to me with a splint or an orthosis that he already had from his elbow all the way to his fingers. And initially we were only able to use his fingers and try to get them moving because the rest needed to be immobilized so that he could heal. After a few months, we were able to put him into something like this, which just immobilized his wrist. Okay. And these are custom braces that we can make for patients that need that immobilization. There are some prefabricated braces. This one, for example, is for the thumb joint that a lot of people tend to have arthritis in. So it's something that we can find different things, either custom or prefabricated, for all kinds of patients.
Now, I heard you mention carpal tunnel and even arthritis, and we know arthritis can be, I got a little ache, to some very severe rheumatoid type stuff.
Sure.
What if somebody's at home and they're thinking, I'm really suffering. Is this for them? Can they just call you guys and say, I think this might help me? Or do you prefer, cases that are really kind of far along?
We will treat anybody that thinks that they need some assistance from us. They'll need a doctor's prescription to come to us in order for their insurance to cover physical therapy.
That's important.
But even if it's something as small as trying to help them learn how to do something maybe a little bit different, that would help with joint conservation so that they put the least amount of stress on the joint that's irritated, we can help with that. Or we can see if there's a different way that they could do something.
All right. So, Chris, we're excited that Chris and I are Rotarians together, and I see him at Powerhouse. So I'm so glad to see that you are on the mend, bud, and doing your thing. So great. And thank you, Jen, for sharing this morning. And give us a phone number or website if people are interested in hearing more about this.
Sure. You can go to www.tidewaterpt.com.
All right. Thank you both for being with us.
Thank
this
you.
morning.